Hello and welcome. I'm so excited to. So now that we're done, our tips and tricks for you to get to know what you need to know, we're going to do a little bit more information about health insurance on campus. So first things first, UHIP, the University Health Insurance Plan, is the health insurance plan that all of you have. It is mandatory for all students, international students that are here in Canada. So whether you're undergraduate, graduate, exchange, whether you're a visiting researcher or a PhD student, all of you have access to the University Health Insurance Plan, or UHIP. If any of you are bringing your family members, or if any of you have kids with you in Canada, be sure to add your family members as soon as possible. I believe the cutoff is 30 days after your arrival. Please add them. There is a late fee if you add them on after that date. So if you have family members, if you have kids with you, be sure to add them. So what UHIP does is it gives you access to the Canadian health system. Specifically, it covers the cost of services like doctor's visits, hospital visits, any sort of emergency things that you might have, like an ambulance or need x-rays. There's actually a full list online if you visit the UHIP website at uhip.ca. And just one thing to note is that it also has some things that it doesn't cover. So it doesn't cover dental work, your teeth. It doesn't cover your eyeglasses and optometrists. And it also doesn't cover most prescriptions as well. Which is why many of our students either get an extended healthcare plan through their student union or student council, or some of our students will purchase an additional healthcare plan if they're not eligible for either of those. So just something to note, you will receive your UHIP card through your @uwo.ca email within the first week or so of arriving. If you don't get it after a week or so, please reach out to us and we'll be able to assist you. I've also included some fun might not be the right word, but some healthcare tips to the side of my presentation as well. Just things to keep in mind as you're navigating the Canadian healthcare system. So healthcare tip number one, print out your UHIP card and keep it with you, either in your wallet, purse, maybe if you have a phone wallet, putting it there as well. A lot of places when you go to access healthcare won't accept a digital copy, like a photo of your UHIP card. So keep a paper one with you. And in the case you're not able to open your phone, if there's ever an accident, I sure hope there's not, they'll be able to use that card to so that you're covered under the UHIP insurance. Healthcare tip number two is add your children and spouses to UHIP. Do it as soon as possible. I will keep reiterating it. It's incredibly important. And then healthcare tip number three is that the UHIP coverage is designed for coverage in Ontario. If you intend on leaving the province or leaving the country, UHIP might not cover you. So reach out to us, book an appointment with one of our international student advisors if you intend on leaving Ontario, maybe visiting the rest of Canada. Just be aware that your UHIP will likely not cover you if you leave the province. So we also have a suite of extended healthcare plans as well for our students. So the first one is for undergraduate students, and they have a plan called Purple Care, which is offered by the University Students' Council, or USC. That is the student union for all undergraduate students at the university. It covers things like dental, eyeglasses, and it covers, I believe, 80% of prescriptions as well. You can learn more information on purplecare.ca, or you can visit online our pre-arrival module about healthcare and health insurance in Canada. That's on our orientation website. So if you scan the QR code on the back of your name tags, you'll be taken to our schedule and you can navigate from the schedule to the modules to learn more. If you haven't completed them yet, I strongly recommend it. One note is that for these extended plans for undergraduate and the one I'm about to cover for graduate students, exchange students are not eligible to be covered under these plans. If you're interested, we do have a website available where you can learn more about purchasing your own extended insurance as well. So if you have any questions about that, please come up to one of us during lunch, or even stop by at the Welcome Center or come in for an advising appointment, and we'd be happy to help you out. So up next is graduate students, and graduate students have an extended health insurance plan called Student Care through the Society of Graduate Students, or SOGS. It works in the same way that the undergraduate plan works, in that it covers eyeglasses, it covers dental work, and it covers prescriptions. And also graduate students, specifically ones who are working as teaching assistants, are eligible for an additional healthcare plan offered through their union, which is PSAC 610. So you actually have access to two different extended healthcare plans as well. So both of those healthcare plans also give you access to mental health and wellness supports as well, including counseling and psychologists. So if you ever need that, those are a great option to access as well. And then once again, check out our module for more information. Great. And then one last thing is, in the case you do need a doctor while you're here, there are many different options. So on campus, if you're looking to check in and get a general appointment with a family doctor, you can actually go to Student Health Services. I recommend going to their website, which is at the bottom of the slide, health.uwo.ca, and you can book either a physical health appointment if you're feeling sick or would like your physical health checked in on or monitored. And you can also book appointments for mental health and wellness as well. So all of these are available to Western students, but you do have to bring your proof of coverage, such as your UHIP card or your extended healthcare plan, and your extended healthcare plan card if you have one as well. So one other thing, there are also walk-in clinics across London. There is an urgent care clinic at St. Joseph's Hospital, which is right next to campus. And as well, there is an emergency room at the University Hospital, which is actually right on campus. Just one thing to note is that emergency room wait times can be long. That might be a bit of a cultural shock to you while you're in Canada. So I recommend going to either urgent care or a walk-in clinic if it's not life-threatening serious. But if it is, go to an emergency room if you feel that you need that. What's the difference between a walk-in clinic, an urgent care clinic, and emergency room? So a walk-in clinic is if you feel you need medical attention, if you're feeling sick, if it's kind of not a big deal, but it needs to be solved. So if you have maybe a cough, or have the flu, or have maybe a rash that's really bad, you'll want to go to a walk-in clinic. If it's something that's more serious or urgent and needs to be resolved now, I recommend going to an urgent care. So things like if you have cut yourself very badly, or have other broken bones, or other sort of serious conditions. And then for the emergency room, that's for some place that you would go if you feel your condition is truly life-threatening and you need to see attention as soon as possible. You can also call 911 if you feel that you're unable to get to an emergency room, and they'll send an ambulance to get you and bring you there as well. So those are the three different options. Well, 5 different options. And anytime you go access healthcare anywhere, on campus, off campus, remember to bring your UHIP card, your proof of your extended insurance as well, and a claim form. And then one last healthcare tip from Andrew is to make sure that you take pictures and have digital copies of your UHIP card. If you have extended healthcare insurance, be sure to keep a photo or a digital copy of those as well. And anytime you complete or fill out a claim form, it's helpful to document and take photos of those as well, just so that you have them and are able to refer back to them if you ever need to. And then one last healthcare tip is if you've brought a spouse with you to Canada and they're working here in Ontario full time and they have a work permit, they might be eligible for OHIP, which is the Ontario Health Insurance Plan. So if you have a spouse that's here working in Canada, reach out to us. We'll be able to assist you, and you might be able to get some of that cost of the UHIP for your spouse reimbursed. So that's healthcare. And some last notes is we actually have a COVID-19 vaccination and testing center on campus, as well as a flu vaccination clinic on campus. So if you'd like to get a COVID-19 booster, and if you'd like to consult with a healthcare professional to determine whether or not you should get a booster with your current doses, I recommend visiting our vaccination and testing clinic. It's in a building called Thames Hall on the 3rd floor, room 3189, and it's open on Mondays to Fridays from 9 a.m. to 4 p.m. It's free of charge for Western students and staff. Just again, be sure to bring your UHIP card and a claim form as well, just to have with you. Some other things to note is that the Public Health in Canada does recommend that you are wearing a mask in public spaces, including indoors, as well as Western does require masks to be worn in any instructional space, which includes classrooms, labs, things like that. And we also do recommend you wear a mask to be kind and to be caring for the people around you as well. You never know what someone else is going through, so it's always helpful to keep a mask with you just in case you need it. And if you're ever feeling unwell, we also recommend you complete Ontario's COVID-19 self-assessment. So it will ask you a few questions about your symptoms, about what you've done over the past 14 days, and it will provide you assistance on whether or not you should seek additional help or seek additional sort of medical care as well. So that's a very helpful tool for you to use if you're ever feeling unwell and want quick and timely information and assistance from the Government of Ontario.